Do you ever feel like your body and your mind are older than your actual age? That the spark you used to have is fading? You're not alone, but it may not be inevitable. There's a key hormone that governs a man's vitality, and when it declines, it can feel like it's stealing your best years. In this video, we're exposing the 7 ways low testosterone could be draining your energy and drive. The good news? Recognizing it is the first step to reclaiming it. Let's start with the number 1 vitality killer. It is easy to accept fatigue and fuzziness as just part of the deal. Every birthday comes with advice to slow down. But gentlemen, slowing down should be a choice, not a mandate forced by hormonal changes. For men over 60, testosterone levels naturally drop. This isn't just about libido or muscles. Low T doesn't just affect one system. It impacts almost every cell in your body. It governs your metabolism, your mood, your bone density, and your drive to simply get things done. When this foundational hormone declines, the entire system struggles. We call this the theft of vitality. We are not offering aggressive fixes here. We are talking about critical awareness. Understanding these 7 silent signs gives you the power to approach your doctor with precision, armed with evidence of what the real problem might be. We cut through the noise here at Gentleman's Vitality, providing expert-backed science you can trust. If that mission resonates with you, make sure you subscribe right now. The first sign is the most dismissed. It is the deep, persistent energy thief. This isn't the tired you feel after a long day of work. This is the exhaustion that survives a full night's sleep. This specific type of fatigue is known clinically as persistent, low-grade exhaustion. You wake up feeling unrested, regardless of how many hours you clocked. It forces you to rely on excessive coffee or naps just to maintain a basic level of function. Testosterone plays a crucial role in cellular energy production, particularly in the mitochondria. When T levels are low, this energy conversion process slows down. Your body is running on half power. If you are experiencing this profound, chronic fatigue, note it down. It is often the first silent sign that hormone levels need investigation. You should try tracking your energy on a scale of 1 to 10 over several weeks. If your baseline remains consistently below a 7, it is time to look deeper than just poor sleep hygiene. The second sign that low T is stealing your vitality is the strength robber, loss of muscle mass and physical function. For years, you could maintain muscle fairly easily, but now your workouts feel fruitless. You're losing strength in basic movements. This is called sarcopenia, and while it is linked to aging, low testosterone accelerates it severely. Testosterone is the primary anabolic hormone in men. It stimulates protein synthesis, which is how muscles repair and grow stronger after exercise. Without sufficient T, your body enters a catabolic state, meaning it breaks down muscle faster than it can rebuild it. This isn't just cosmetic. This impacts your mobility and injury risk. If your grip strength has noticeably weakened, or if you can no longer lift the same amount you could 6 months ago, low T may be quietly undermining your physical fitness. Sign 3 is the motivation killer. Low testosterone is closely linked to mood disorders that manifest as apathy or irritability. It's not a sudden breakdown, but a gradual flattening of emotion. You might feel less joy, less excitement, and crucially, less drive to pursue goals. This is often misdiagnosed as generalized depression, or simply being grumpy. The science shows that T receptors are highly concentrated in the limbic system, the area of the brain responsible for emotion and motivation. When these receptors are understimulated, the internal fire fades. The feeling is less sadness and more indifference. You stop looking forward to activities you once enjoyed, like hobbies or social gatherings. If you find yourself consistently lacking the motivation to start simple tasks, your brain's chemistry may be signaling a hormonal issue. Remember, low motivation affects productivity, which further lowers your confidence. The fourth vitality drainer is the confidence suppressor. Unexpected weight gain and changes in body composition, especially around the middle. This specific type of weight gain, known as truncal or visceral obesity, is tightly linked to low T. The relationship is circular. Low testosterone promotes fat storage, and excessive fat tissue, particularly visceral fat, contains an enzyme called aromatase. This enzyme converts the remaining testosterone in your body into estrogen, compounding the problem. This chemical shift lowers your T further and increases fat storage again. It's a vicious cycle that makes weight loss feel impossible, even with diet and exercise. This change in appearance and control can profoundly affect self-confidence. If your waistline is expanding despite consistent effort, your hormones might be blocking your progress. Breaking this cycle requires addressing both diet and hormonal balance. The fifth and perhaps most distressing sign is the sharpness softener, brain fog and cognitive fuzziness. This is why we asked you to keep watching until this point. Many men assume memory loss is inevitable. Low T can manifest as difficulty concentrating, slower verbal recall, and a general lack of mental clarity. Testosterone supports neural function and protects nerve cells in the brain. Adequate T levels are essential for fast processing speed and executive function. When T drops, many men report that their thinking feels muddy. They search for simple words or struggle to follow complex conversations. If you find yourself consistently feeling mentally sluggish, like your computer processor is slowing down, consider that it might be hormonal, not inevitable cognitive decline. Addressing this sign can significantly improve your quality of life and professional confidence. Moving to the bedroom, the sixth vitality drainer is the bedroom intruder. We're not just talking about erectile dysfunction, which can have many causes. The specific silent sign is the loss of morning erections. Nocturnal penile tumescence, or morning wood, is a key physiological indicator of circulatory and hormonal health. It is a necessary sign that your body is repairing and maintaining function overnight. The absence of morning erections, even if performance is adequate during intimacy, is a strong, silent indicator that T levels are insufficient to maintain fundamental vascular health. This is a subtle physical signal that doctors pay close attention to, yet men often overlook it or feel too uncomfortable to mention it. This sign, coupled with genuinely reduced libido, not just a temporary lack of desire, but a persistent low drive, points directly toward low hormonal levels. Finally, the seventh drainer is the recovery blocker. If you feel that you take significantly longer to bounce back from physical exertion than you used to, low T may be slowing your repair systems. Whether it's recovering from a heavy workout or simply recovering from yard work or a long flight, protracted recovery time is a silent signal. Testosterone enhances red blood cell production, which carries oxygen and nutrients necessary for repair. It also reduces inflammation following exertion. When T is low, repair processes stall, injuries linger, and muscle soreness persists for days instead of hours. If you find your weekend activities now require 2 full days of painful recovery, it's a sign that your body's self-repair mechanism needs support. This symptom prevents you from maintaining an active lifestyle, creating a cascading effect on your overall health. So you have seen the 7 silent thieves: the profound fatigue, the strength robber, the motivation killer, the confidence suppressor, the sharpness softener, the bedroom intruder, and the recovery blocker. These symptoms, when grouped together, paint a very clear picture. They show us that low testosterone is not just about one aspect of health. It's about a total, systemic erosion of your ability to live a strong, vibrant life. Reclaiming your vitality requires more than just masking the symptoms. It requires addressing the underlying chemical imbalance. The first step in taking control is recognizing that feeling this way is not normal, regardless of your age. The next critical step is ensuring you have the right conversation with your primary care provider. Do not just ask for a quote-quote testosterone test. Ask for a comprehensive hormonal panel. Specifically, you want to see your total testosterone and, importantly, your free testosterone levels. Free T is the amount of hormone actually available for your cells to use, and it often provides a better clinical picture than the total number alone. Remember to get this test done in the morning, typically before 10 a.m., as T levels peak early in the day. Fasting blood draws provide the most accurate baseline results. It is common for men to feel intimidated talking about this subject, but viewing it clinically helps. Frame your symptoms using the language we've discussed. I'm experiencing persistent, non-restorative fatigue and unexplained loss of grip strength. This provides your doctor with tangible, medical data points, rather than vague complaints. If your levels come back low, the medical approach will involve a thorough look at your full health history. There are many evidence-based treatment paths, but often, the first steps involve optimizing foundational lifestyle habits that naturally support hormone production. We must tackle common objections. Many men believe that they are too old to benefit from addressing hormonal health. The truth is that optimizing T levels, whether through lifestyle changes or medical intervention, can dramatically improve quality of life, bone density, and muscle mass at any age. It's not about being 20 again. It's about reducing risk factors and improving your felt age, ensuring you can enjoy your retirement with vigor. Others worry that focusing on T is vain. It is not vanity, it is preventative health. Strong muscles, dense bones, and a sharp mind are the cornerstones of independent living as you age. This is the definition of taking control of your health. The key lifestyle pillars supporting healthy T levels are deep, restorative sleep, strategic resistance training, and nutrient-dense, clean eating. Prioritize getting 7 to 9 hours of quality sleep every night. Sleep is when your body produces the majority of its daily testosterone. Also, focus on compound movements in your fitness routine, such as squats or pushes, which naturally signal hormone production. And ensure your diet includes healthy fats, which are the building blocks of all steroid hormones, including testosterone. These are non-negotiable tools in your arsenal. Whether you pursue further medical treatment or not, they are actionable steps you can start taking today to reduce the stress on your hormonal system. Now, you have the 7 vital signs. You have the knowledge to advocate for yourself in the doctor's office. Do not let these silent thieves continue to steal your vitality. Take the information you learned today and use it to reclaim the energy and drive that define a vibrant life. If you found this evidence-backed analysis helpful, please like this video. Your support ensures that Gentleman's Vitality can continue delivering crucial health strategies designed specifically for men over 60. Subscribe now to keep mastering your health, and remember, the strongest version of yourself is always within reach. The constant feeling of being drained is terrible, but the link between low testosterone and apathy is often even more destructive to your daily routine. We talked about how low T affects your brain's motivation centers, leading to indifference. This manifests as procrastination and a loss of personal standards. Think about the small things you use to maintain effortlessly: a clean garage, regular paperwork filing, or planning weekend activities. If you now find yourself letting those things slide, feeling that they are simply too much effort, that shift is often hormonal. It's not laziness. It's a failure of the reward system in the brain to properly signal the effort is worthwhile. Addressing the hormonal balance can often reignite that inherent drive, making small successes feel rewarding again. Start simple. Choose one item you have been putting off for weeks and complete it today. That small win is a chemical boost that begins to rebuild the motivation muscle. The physical appearance changes also feed into the emotional drain. We detailed the confidence suppressor, the shift toward visceral fat. This is important because fat tissue acts like an endocrine organ itself. It is not just inert storage. This fat signals inflammation throughout the body, further disrupting the delicate balance of hormones. This means the symptom of weight gain becomes a cause of more problems. The best countermeasure, alongside diet changes, is consistent, heavy resistance training. Lifting weights, even moderate weights, sends a potent signal to your body to stop prioritizing fat storage and start prioritizing muscle repair. You don't need to join a CrossFit gym. Using resistance bands or performing bodyweight exercises like push-ups and squats 3 times a week provides this critical stimulus. This action helps tip the balance back in your favor, reducing the inflammation that accelerates hormonal decline. Another key area where low vitality manifests is in poor cardiovascular function, specifically blood sugar management. Testosterone has a strong protective relationship with insulin sensitivity. As T levels drop, cells become less responsive to insulin. This results in higher circulating blood sugar, which damages blood vessels and drives the risk of type 2 diabetes. Men with low T frequently find themselves riding a blood sugar roller coaster, leading to more energy crashes and cravings, which further exacerbates the fatigue we discussed earlier. This is not just a silent sign, it's a silent threat. To mitigate this risk, focus on pairing carbohydrates with protein and healthy fats at every meal. This slows down sugar absorption and keeps your insulin response steady. Simple changes, like adding walnuts to your morning oatmeal or swapping white rice for brown rice can have a cumulative protective effect on your metabolic health. The subtle changes in your body's repair mechanisms extend to bone health too. This is the truly silent thief of long-term health. Testosterone is essential for bone mineral density maintenance in men. Low levels of T lead to accelerated bone loss, potentially resulting in osteopenia and osteoporosis. Unlike a broken arm, bone loss has no early symptoms. You do not feel your bones weakening until it's too late, until a simple fall results in a fracture. This is a crucial distinction between men and women. While estrogen decline is primary in women, T decline is the main culprit in men. To proactively fight this, increase your intake of vitamin D and K2, and continue with that heavy resistance training we mentioned. The stress of the weights against the bone stimulates growth, making your skeleton more resilient. This is an investment you make today to prevent a catastrophic injury 10 years from now. The combination of brain fog and chronic fatigue often leads men to seek quick fixes, usually in the form of stimulants or excessive caffeine. While caffeine can momentarily mask the problem, relying on it only deepens the cycle of non-restorative sleep. The persistent stimulation prevents your body from dropping into the deep, critical phase of sleep required for hormonal repair. Remember, your body produces the most T during deep REM sleep. To break this dependency, try cutting off all caffeine intake after noon. This small adjustment can significantly improve your sleep architecture, giving your body a chance to naturally reset its hormonal rhythm. Improved sleep quality is often the cheapest and most effective way to start feeling more energetic. Let's quickly address the issue of mood stability again. The irritability associated with low T is often projected outward, impacting relationships with spouses and family. It's the constant short fuse, the impatience over minor inconveniences. Recognize that this is a chemical reaction, not a character flaw. This insight can help you apologize for the reaction and explain the underlying struggle. When you feel that tension rising, take 5 minutes to focus on deep diaphragmatic breathing. This simple technique shifts your nervous system from fight or flight to rest and digest, giving you a chance to reset before the irritation escalates. Awareness and proactive communication are key to protecting your personal connections from hormonal mood shifts. We have emphasized that you need to discuss these symptoms with your doctor, but how do you maximize that short appointment time? Before you go, prepare a 3-day symptom diary. List the 7 signs we covered and give each a score from 1 to 10 based on severity. For example, chronic fatigue score, 8/10. Noticeable decrease in motivation, 7/10. This objective data makes your concerns impossible to dismiss. It moves the conversation past "I feel tired" to "I have documented evidence of functional decline linked to recognized hormonal symptoms." This preparation is the single most effective way to guide your physician toward the right diagnostic tests. Be an active participant in your health journey, not just a passive recipient of advice. The journey to reclaiming your vitality starts with clarity and action. You now know the signs and the essential next steps. You understand that low testosterone is not simply an annoyance. It is a systemic threat to your long-term independence, strength, and happiness. Do not wait for a major health event to force your attention. Start tracking your energy and mood today. Implement those small lifestyle changes immediately, especially regarding sleep and resistance training. These actions stack up quickly. If this deep dive into the science of men's health empowers you to take action, please like this video to help others discover this critical information. Subscribe to Gentleman's Vitality for more strategies that cut through the noise and provide clear, expert guidance on mastering your health. Living a stronger, healthier, and more vibrant life is entirely possible. Another frequent oversight when addressing vitality is the state of your gut health. This might seem disconnected from hormones, but the gut biome plays a vital, silent role in managing inflammation and regulating estrogen levels. When your gut flora is unbalanced, it can lead to a condition known as estrogen dominance, where the body struggles to efficiently excrete excess estrogen. As we discussed, higher estrogen levels actively suppress your body's natural testosterone production. Therefore, a sluggish gut directly contributes to the low T cycle. To improve this, focus on consuming fermented foods like plain yogurt, kefir, and high-quality sauerkraut. These foods introduce beneficial bacteria that help restore balance, reducing inflammation, and supporting better hormonal metabolism. This foundational dietary work is often the missing piece in a men's health regimen. Let's revisit the concept of the strength robber. Many men in their 60s are trying to stay active by focusing on long-duration cardio, running, cycling, or long hikes. While these activities are excellent for cardiovascular fitness, they are not optimized for testosterone maintenance. Excessive long-duration cardio without adequate recovery can actually increase cortisol, the stress hormone, which works directly against testosterone. Cortisol signals the body to slow repair and conserve energy, accelerating muscle breakdown. To counteract this, shift some of your aerobic time to high-intensity interval training, or HIIT, and ensure 2 to 3 dedicated resistance training sessions weekly. Shorter, sharper bursts of effort stimulate anabolic hormones better than long, slow endurance sessions, protecting your muscle mass and supporting T levels. The cognitive symptoms, the sharpness softener, can also be influenced by what you eat. Specifically, chronic low-grade inflammation driven by poor diet impacts blood flow to the brain, contributing to brain fog. Consuming high amounts of processed sugars, refined oils, and excessive alcohol accelerates this inflammation. To sharpen your focus, prioritize foods rich in omega-3 fatty acids, such as fatty fish, flax seeds, and walnuts. Omega-3s are powerful anti-inflammatories that support healthy cell membranes, including those in the brain. Making this dietary shift is a direct, practical way to start clearing the mental haze that low vitality often brings. When reviewing your symptoms for your doctor, pay special attention to skin changes. While less common, low testosterone can be associated with unusually dry, thin skin, or even minor changes in body hair distribution. Testosterone influences the health and thickness of your skin's collagen structure. It also dictates male hair patterns. If you notice a substantial reduction in body hair on your chest, limbs, or face, it's a physical clue your body is reacting to hormonal changes. Mentioning these non-standard signs adds valuable depth to your medical profile. A comprehensive picture of symptoms helps your doctor rule out other potential causes. Remember the subtle but pervasive nature of the motivation killer. This loss of drive can impact your career, your financial planning, and your desire to engage with your community. It's not about lacking ambition, it's about lacking the hormonal fuel to execute. If you're struggling with apathy, try implementing a simple habit tracking system. It could be as basic as a calendar where you check off daily tasks, like walking for 30 minutes or completing a small household chore. Visualizing your compliance and seeing a chain of consecutive success days helps restore the brain's sense of achievement, which can counteract the hormonal indifference. This small psychological hack provides immediate positive feedback while you work on the underlying physiological issues. We must also touch on the hidden impact of sleep apnea. This condition, which causes breathing to repeatedly stop and start during sleep, is strongly associated with plummeting testosterone levels. If your partner has noticed persistent, loud snoring, or if you wake up with headaches and feel exhausted despite 8 hours in bed, you need to be screened for sleep apnea. The resulting oxygen deprivation and disrupted sleep cycles severely inhibit the nightly T production cycle. Treating sleep apnea, often with a simple CPAP machine, can sometimes lead to a significant, natural rebound in testosterone levels, resolving the fatigue and low vitality without additional intervention. Do not mistake heavy snoring for harmless sleep. It could be actively compromising your hormonal health. To truly master your health, you need consistency, not perfection. You have learned about the 7 signs and several corresponding lifestyle fixes. The journey to higher vitality is built on stacking small, sustainable habits. Don't try to implement all these changes at once. Start with the most impactful area, sleep hygiene. Cut the late-night screens and caffeine. Prioritize the quality of your rest. Then, incorporate 2 days of resistance training. This methodical approach prevents burnout and ensures that your new habits become second nature. Mastering your health is a marathon, and consistency is your fuel. If you find these actionable step-by-step strategies valuable, be sure to like this video and subscribe to Gentleman's Vitality for more clear, science-backed guidance delivered every week. The subject of environmental factors is often overlooked, yet they can silently compromise hormonal balance. We are surrounded by chemical disruptors, known as endocrine disrupting chemicals, or EDCs. These chemicals, found in certain plastics, pesticides, and personal care products, mimic estrogen in the body. When these compounds build up, they contribute to that estrogen dominance, furthering the suppression of natural testosterone. This is a subtle thief that operates outside of diet and exercise. To minimize your exposure, consider swapping plastic storage containers for glass and avoiding heating food in plastic. Read labels on personal care items and favor products with simpler, recognizable ingredients. Reducing this low-level chemical interference gives your body a better chance to regulate its hormones autonomously. We've discussed the importance of mental clarity, the sharpness softener. Beyond diet, chronic stress is a powerful enemy to cognitive function and hormone levels. Long-term high stress keeps cortisol elevated, constantly stealing resources that should be dedicated to T production and brain repair. Cortisol actively blocks the receptors that T needs to do its job. It's impossible to eliminate all stress, but you can change your reaction to it. Incorporate simple mindfulness techniques into your daily routine. This could be 5 minutes of quiet meditation, or even just sitting silently and focusing on your breath before starting your day. This practice helps modulate the body's stress response, providing a crucial hormonal buffer against daily pressures. Let's return to the confidence suppressor, weight management. Specifically, many men focus solely on calorie restriction, which can be counterproductive for T levels. Severe calorie deficits signal starvation to the body, causing it to prioritize survival hormones like cortisol and downregulate non-essential hormones like testosterone. This often leads to that frustrating plateau where you lose motivation and strength. Instead of extreme dieting, focus on nutrient density and meal timing. Ensure your first meal of the day is rich in protein and healthy fats. This supports steady energy throughout the morning and avoids the rapid blood sugar spikes that derail hormonal balance. Eating for hormone support is about quality and timing, not deprivation. The physical signs of the strength robber also connect to joint health. Low T is linked to increased inflammation, which contributes to chronic joint aches and pains. This pain prevents men from engaging in resistance training, which further accelerates muscle loss. It becomes a spiraling decline in mobility. If joint pain is your barrier to exercise, consider low-impact resistance training. Water aerobics, swimming, or machine-based weight training allows you to build muscle and strengthen bones without the high impact on vulnerable joints. Finding ways to safely apply resistance is critical to breaking the pain and weakness cycle. When interpreting your blood work, be aware of what is considered normal. Laboratory reference ranges are typically very broad, established by averaging results from a wide population, including many men who are already experiencing symptoms. A result that is technically within range might still be suboptimal for you, especially if you are displaying several of the 7 silent signs. If your total T result is on the lower end of the reference range and you are symptomatic, you have a solid case to ask for further investigation into free T and possibly other related hormones like luteinizing hormone. Your goal is to optimize your function, not just pass a laboratory test. Always trust your symptoms over a single number on a lab sheet. For those experiencing the bedroom intruder, the loss of morning erections, a simple nitric oxide boosting strategy can be beneficial alongside addressing the hormonal foundation. Nitric oxide is crucial for vascular health and dilation. Foods rich in nitrates, such as beets and dark leafy greens like spinach and arugula, are powerful natural enhancers of nitric oxide. Incorporating these foods daily supports circulation, which is essential for that physiological indicator of health. This practical dietary step supports your body's ability to perform the vascular function necessary for a healthy nocturnal repair cycle. The consistent message is that vitality is not something you passively wait for. It is something you actively cultivate. Every time you choose better sleep, every time you choose resistance over sitting, you are sending positive signals to your endocrine system. You are telling your body to prioritize repair, strength, and drive. These small, deliberate choices accumulate into major improvements in how you feel and function. Do not underestimate the power of these foundational shifts. If you are committed to making these changes and maximizing your health in your 60s and beyond, like this video right now. We are here to provide the expert knowledge you need every week. Join the Gentleman's Vitality community by subscribing today. Let's dive deeper into the science behind the persistent fatigue thief. Many people confuse hormonal fatigue with simple lack of physical conditioning. The crucial difference is how fast you recover, particularly from minor exertions. If walking up a flight of stairs leaves you truly winded and you need a long time to return to baseline, that speaks to a systemic energy deficit, often hormonal. Testosterone plays a role in red blood cell production in the bone marrow. Lower T can lead to a subtle form of anemia, meaning less oxygen is carried throughout the body. Less oxygen equals less cellular energy, and therefore, chronic fatigue. If your doctor finds you are mildly anemic, you should immediately ask them to check your testosterone levels as a potential contributing factor. We must also consider the role of vitamin D. This is not strictly a hormone, but it functions like one and is crucial for maintaining T production. Studies consistently show a strong correlation between low vitamin D levels and low testosterone. Since many men over 60 spend less time outdoors or use sunblock, deficiency is rampant. If you are experiencing any of the 7 silent signs, getting your vitamin D levels checked is just as important as checking your T. Supplementation is often necessary to reach optimal levels, which supports your hormonal foundation. Make sure you discuss the appropriate dosage with your physician based on your blood test results. This is a simple, cost-effective intervention that can boost your vitality. The motivation killer often pairs with a sense of emotional withdrawal. This is when men start limiting their social circles or declining invitations to previously enjoyed events. They become apathetic not just to chores, but to people. This withdrawal is rooted in the lack of chemical reward associated with social interaction when T levels are depressed. Low T can decrease the sensitivity to dopamine, the pleasure and reward neurotransmitter. Reversing this requires conscious effort to re-engage socially, even when you don't feel like it. Force yourself to attend one social event per week. Social interaction, particularly laughter and shared activity, naturally boosts feel-good hormones that begin to push back against hormonal apathy. This acts as a behavioral countermeasure to the internal chemical lull. Addressing the confidence suppressor, that visceral fat, also requires understanding the importance of essential minerals. Zinc and magnesium are 2 minerals that are frequently deficient in the aging male diet, and both are fundamental cofactors in testosterone synthesis. Zinc is particularly important in preventing the conversion of T to estrogen. Magnesium is vital for improving sleep quality and insulin sensitivity. If your body lacks these basic building blocks, it cannot efficiently produce or utilize testosterone, regardless of how much you work out. Focusing your nutrition on foods rich in these minerals, like pumpkin seeds, oysters, and dark leafy greens, provides the necessary fuel for optimal hormone health. When dealing with the sharpness softener, try using structured mental exercises. Just as you do resistance training for your muscles, your brain needs challenging work to maintain cognitive speed. This doesn't mean just watching the news. It means actively learning a new skill, playing complex strategy games, or dedicating time to learning a new language. These activities build new neural pathways and support overall brain health, mitigating the negative cognitive effects associated with low vitality. Maintaining mental discipline directly complements the hormonal work you are doing. Finally, let's look at alcohol consumption as a silent factor. While moderate alcohol intake may be acceptable, chronic, heavy drinking significantly compromises liver function. The liver plays a crucial role in regulating and clearing hormones. A stressed liver cannot properly metabolize estrogen, leading to higher circulating levels, which, as we know, suppresses T. Furthermore, alcohol directly interferes with sleep quality, undermining the nightly production cycle. If you are serious about optimizing your vitality, minimizing alcohol intake is one of the quickest and most powerful changes you can make to support hormonal balance. Every element of your lifestyle either supports or sabotages your health goals. Choose the habits that build you up. This integrated approach to health is what defines the Gentleman's Vitality methodology. If you value this type of comprehensive expert advice, hit the like button and subscribe today. We need to talk about the often ignored connection between the strength robber and your mobility. When you lose muscle mass due to low T, you also lose connective tissue strength and flexibility. This makes you vulnerable to simple strains and dramatically increases your risk of falling. A fall, especially after age 60, is a major threat to independent living. Low T isn't just taking away your biceps, it's quietly eroding your protective stability. To address this, incorporate specific balance and flexibility exercises into your routine 2 to 3 times a week. Simple moves like standing on one leg, heel-to-toe walking, and basic hip flexor stretches maintain your functional mobility, ensuring your body remains resilient even if your hormone levels are fluctuating. The bedroom intruder, the decline in morning erections and libido, often causes a deep, hidden layer of psychological stress. This stress itself releases cortisol, which further suppresses T. It becomes a loop where the physical symptom drives the stress that exacerbates the symptom. Breaking this cycle requires acknowledging the stress. Instead of focusing solely on performance, focus on intimacy and connection. Open communication with your partner about the physical changes you are tracking removes the burden of secrecy and reduces the associated stress, which can sometimes be as important as the hormone levels themselves. Let's re-examine the fatigue thief through the lens of inflammation. Chronic, low-grade inflammation is a hallmark of aging, and low T exacerbates it. This systemic inflammation forces your immune system to be constantly active, which drains energy away from necessary daily functions. Think of it as a background process running constantly on your computer, slowing everything down. Diet is your primary tool here. Incorporate potent anti-inflammatory agents like turmeric, ginger, and berries into your daily diet. These simple additions help quench the internal fire, freeing up energy resources and giving your body a better chance to recover and regulate hormones. We previously mentioned the importance of zinc for testosterone synthesis. However, another mineral, boron, deserves attention. Boron is a trace mineral that has been shown in some studies to help protect free testosterone from binding with sex hormone binding globulin, or SHBG. SHBG essentially locks up testosterone, preventing it from being used by the cells. By keeping more of your T free and available, boron supports your vitality. You can find boron naturally in raisins, almonds, and avocados. While supplements exist, prioritizing these nutrient-rich foods is the most balanced approach to ensuring adequate intake of this silent helper. The motivation killer can be profoundly influenced by your environment. Your space dictates your behavior. If your home or workspace is cluttered and disorganized, it creates a constant visual and mental distraction, contributing to the cognitive fuzziness and apathy we discussed. Take 1 hour this week to declutter the area where you spend the most time. A clean, organized environment reduces the need for constant mental filtering, allowing your limited mental energy to focus on tasks that actually matter. Creating external order can help restore internal drive. Understanding the confidence suppressor requires recognizing the role of chronic dieting stress. Many men skip meals or follow aggressive, complicated eating protocols trying to lose the visceral fat. The key hormonal strategy is consistency and simplicity. Eating 3 well-balanced meals a day at roughly the same time helps regulate your circadian rhythm and your insulin response. This consistency reduces metabolic confusion, providing a stable platform upon which your hormone system can rebuild. Focus on reliable nutrition every day, rather than dramatic shifts every few weeks. We've covered the 7 signs and practical strategies. The final element of success in men's health is accountability. Find a trusted friend or partner who understands your goals and can hold you accountable for the small daily commitments, the walks, the resistance training, the early bedtime. Sharing your goals dramatically increases your likelihood of success. Don't go it alone. Being part of a community, even the one here at Gentleman's Vitality, strengthens your resolve. If you are ready to take these final, crucial steps toward full vitality, like this video and subscribe. We are here every week to provide the tools you need to live stronger. Let's look at the fatigue thief from a different perspective: hydration. Chronic mild dehydration is shockingly common, especially as men age, and it presents almost identically to hormonal fatigue. When your body is dehydrated, blood volume decreases, forcing your heart to work harder to circulate oxygen and nutrients. This added cardiovascular strain translates directly into profound, non-restorative tiredness. Before diagnosing a hormonal issue, rule out the simplest causes. Ensure you are consistently drinking enough water throughout the day. Keep a water bottle handy and aim for clear or pale yellow urine. Proper hydration is a zero-cost intervention that immediately improves cellular function and energy levels. The subtle changes in your mental state, the sharpness softener, can be aggravated by social isolation. We touched on motivation, but true cognitive resilience comes from continuous engagement with diverse viewpoints and complex discussions. If you are retired and your daily mental load has decreased, you must replace that stimulation. Join a book club, volunteer in a teaching role, or engage in lively, respectful debate. Keeping your mind active and socially connected helps preserve neural density, acting as a buffer against the cognitive decline associated with aging and hormonal imbalance. Use your mind, or you will lose its edge. When battling the strength robber, remember the power of protein timing. To maximize muscle synthesis, you need a steady supply of amino acids throughout the day. For men over 60, protein needs are often higher than generally advertised. Aim for 30 to 40 grams of high-quality protein at each major meal. This consistent intake provides the raw materials your body needs to rebuild muscle, helping your body utilize whatever testosterone it has available more effectively. If you are struggling to hit this target, use supplemental protein powder to bridge the gaps between meals. Consistent protein intake supports muscle preservation, protecting your mobility and vitality. The insidious nature of the confidence suppressor is its effect on your posture. Men who gain weight and feel tired often adopt a slumped posture, which physically restricts lung capacity and makes them appear older and less confident. Studies show that simply adopting a more upright, powerful stance can immediately reduce cortisol levels and slightly increase testosterone output. This is a powerful mind-body connection. Practice standing tall, pulling your shoulders back, and engaging your core. This small physical shift sends a neurological signal of confidence and competence, helping to counteract the apathy and low mood associated with hormonal decline. For those experiencing the bedroom intruder, consider the often overlooked environmental factor of temperature. Testicular temperature regulation is vital for health. Wearing restrictive, tight-fitting underwear or spending long periods in very hot environments, such as prolonged hot tub use, can impair production. This is a common-sense intervention. Prioritize comfortable, breathable clothing, especially overnight. Supporting the body's natural temperature regulation system is one small, passive way to ensure optimal function where possible. We must address the fear surrounding medical treatment. If testing reveals clinically low testosterone levels and symptoms are severe, your doctor may discuss testosterone replacement therapy, or TRT. It is vital to understand that this is a serious medical decision requiring careful risk assessment and ongoing monitoring. Never seek treatment from unregulated sources. Any potential treatment must be managed by a qualified endocrinologist or specialist who can monitor your red blood cell count, prostate health, and overall cardiovascular markers. The goal is always to restore function safely and responsibly within a medically supervised framework. Knowledge empowers you to ask the right questions and ensure your health is managed with the utmost care. Finally, remember the importance of celebrating small wins. Mastering your vitality is a journey of incremental progress. Every time you successfully choose the gym over the couch, or choose water over soda, you are actively winning the battle against the thieves. Acknowledge and appreciate these wins. Positive reinforcement fuels motivation. This commitment to small daily victories is the key to sustaining a healthy, vibrant life far beyond your 60s. If these practical insights have given you new tools for that journey, please let us know by liking this video. Subscribe to Gentleman's Vitality for more strategies designed to help you live stronger and conquer the aging process on your terms. Let's expand on the systemic impact of the recovery blocker. Beyond muscle soreness, low T can slow down your healing process for minor injuries, like cuts or scrapes. This sluggish recovery is a red flag indicating reduced cellular repair efficiency. Testosterone influences various growth factors that accelerate tissue regeneration. If you notice that minor wounds linger longer than they used to, it's another subtle but important data point to share with your physician. This points toward a deeper issue in systemic resilience, which is often tied back to suboptimal hormonal status. We highlighted the importance of resistance training, but the timing of that training can also influence your T levels. While intense exercise is beneficial, doing it too late in the evening can be detrimental. Intense exercise raises core body temperature and releases endorphins, making it harder to wind down and achieve that restorative, deep sleep where testosterone production peaks. Try to complete your highest intensity workouts at least 4 hours before you plan to go to bed. Shifting your strenuous activity earlier in the day, supports both your strength goals and your critical sleep hygiene, reinforcing the hormonal balance you are working to achieve. When dealing with the apathy of the motivation killer, look into the concept of micro-challenges. Apathy thrives on inertia. A micro-challenge is a tiny, achievable goal, like reading 5 pages of a book or spending 10 minutes learning something new. These micro-challenges require minimal effort, but generate a sense of accomplishment. Successfully completing these tasks releases small hits of dopamine, helping to recalibrate your brain's reward system and gradually overcome the feeling of indifference. Starting small is the secret to building monumental change in your psychological state. The confidence suppressor, manifested by visceral fat, can be fought effectively by timing your healthy fats intake. Dietary fat is essential for hormone synthesis, but not all fats are equal. Focus heavily on monounsaturated and polyunsaturated fats found in avocados, nuts, seeds, and olive oil, while minimizing heavily saturated and trans fats. Consuming a good source of healthy fat, like a handful of almonds, mid-morning can help regulate blood sugar, stabilize your energy, and provide the building blocks your body needs to manufacture hormones efficiently. Avoid the low-fat craze of previous decades. Your hormones require healthy fat to function. For those concerned about the sharpness softener, consider incorporating intermittent fasting in consultation with your doctor. Intermittent fasting, when performed safely and moderately, has been shown to increase levels of brain-derived neurotrophic factor, or BDNF. BDNF is often called miracle grow for the brain. It promotes the growth of new brain cells and protects existing ones. By giving your digestive system a break, you allow your body to focus energy on repair and neurogenesis, which directly combats the mental fogginess associated with low vitality. This is a dietary tactic that supports both metabolic health and cognitive clarity. We must clarify the distinction between aging and disease. Many men accept these 7 signs as simply normal aging. While hormone levels do decline with age, the severity and speed of the decline often push men into a clinically deficient range that profoundly impacts function. The goal of Gentleman's Vitality is to ensure your decline is slow, gradual, and managed, not a rapid descent into frailty and diminished capacity. Never accept severe, persistent fatigue or a complete loss of motivation as inevitable. That acceptance prevents you from seeking solutions. Be proactive. Be vigilant about tracking these silent signs and understand that solutions exist to help you age powerfully. If you have recognized several of the signs discussed today, the immediate action is information consolidation. Take notes, gather your data, and schedule that appointment. Do not delay. Early intervention, whether through lifestyle adjustments or medical support, yields the most profound, life-changing results. Take control of your hormonal health now to secure your vitality for the next decade. If this deep dive has been the catalyst you needed to act, please like and share this video. By subscribing to Gentleman's Vitality, you join thousands of men committed to mastering their health and living stronger every day. Let's bring the narrative full circle by addressing the psychological weight carried by the 7 silent signs. The cumulative effect of the fatigue thief, the motivation killer, And the confidence suppressor is often chronic low self-esteem. When a man feels physically and mentally diminished, his sense of identity suffers. He may unconsciously retreat from leadership roles or challenging opportunities. Recognizing the hormonal basis for these feelings is liberating. It removes the moral judgment that you are failing and replaces it with a clinical pathway that your body needs support. This mindset shift is crucial for recovery. We discussed the importance of resistance training for the strength robber. For men over 60, focusing on the eccentric phase of lifting is key. The eccentric phase is when the muscle lengthens under tension, like slowly lowering a weight after a curl. This portion of the lift causes more micro damage to the muscle fibers, which triggers a stronger repair signal and thus a greater hormonal response. Slowing down your lifts and focusing on control, particularly on the way down, is a highly efficient way to maximize the muscle building and T-supporting benefits of every exercise session. Efficiency is paramount when managing energy levels. Returning to the bedroom intruder, the vascular health component is non-negotiable. Beyond nitric oxide-rich foods, consider the impact of elevated blood pressure. Hypertension damages the delicate endothelial lining of the blood vessels, which is critical for that physiological response. If your blood pressure is high, it is actively sabotaging your vascular and hormonal health. Consistent aerobic exercise, even moderate walking for 30 minutes daily, is essential for keeping your blood vessels elastic and healthy. View your daily walk as a fundamental piece of your hormonal therapy, not just an optional activity. The cognitive symptoms of the sharpness softener can be dramatically mitigated by reducing exposure to continuous noise pollution. Chronic background noise, whether from traffic, construction, or even excessive television, acts as a constant low-level stressor. This stress keeps cortisol slightly elevated, impairing concentration and exacerbating brain fog. Dedicate time each day to genuine quiet, whether it's sitting in a park or simply turning off all electronic devices for 30 minutes. Creating mental stillness allows the prefrontal cortex, the part of the brain responsible for executive function, to rest and reset. This simple habit can significantly improve your clarity. When preparing for your medical consultation, gather data on more than just your symptoms. Bring a list of all your current medications, including supplements. Certain commonly prescribed medications, such as some opioids or even high doses of specific antidepressants, are known to suppress testosterone production. Your doctor needs the full picture to determine if the low T is primary, from the testes, or secondary, caused by pituitary issues or external factors like medication. Being transparent about your pharmaceutical profile is essential for accurate diagnoses and effective management. The fatigue thief, when combined with chronic pain, creates a spiral of inactivity. We briefly mentioned low-impact exercise, but let's emphasize therapeutic movement like yoga or Tai Chi. These practices improve flexibility, reduce joint pain, and, crucially, teach breath control. Better breath control and reduced perceived pain enable you to be more active, breaking the sedentary cycle that crushes T levels. Finding a movement practice that you can sustain without injury is far more valuable than pursuing sporadic, high-intensity workouts that leave you sidelined. We have provided a comprehensive framework for identifying and addressing the 7 silent signs. This knowledge is your protective shield. Do not treat this information as just another video. Treat it as an instruction manual for optimizing the next phase of your life. The path to sustained vitality requires constant vigilance and informed action. Commit to mastering one new health habit this week. Make that commitment now. If this video has empowered you with the science to make that change, like the video and subscribe to Gentleman's Vitality. We are your dedicated resource for living a stronger, healthier, and more vibrant life. Let's conclude by reiterating the absolute necessity of sustained consistency over short bursts of extreme effort. Many men attempt a radical diet or workout routine for 2 weeks, see marginal results, and then revert to old habits, concluding that the problem is unsolvable. This approach fails the hormonal system. Hormones adjust slowly. You must give lifestyle changes at least 3 to 4 months to register significant, measurable improvements in energy, mood, and body composition. If you only implement resistance training once a week, you will not see the protective effect needed against the strength robber. If you only improve your sleep on weekends, the fatigue thief will remain in charge during the week. True vitality requires diligence and patience. When dealing with the confidence suppressor, use objective measurements beyond the scale. Focus on tracking your waist circumference. Visceral fat is the most dangerous kind, and tracking this measurement provides a direct, honest metric of your success in reversing that hormonal imbalance. A shrinking waistline is a more accurate and motivating indicator of improved metabolic and hormonal health than a fluctuating number on the bathroom scale. Celebrate the inches lost from your middle, as this directly reflects a reduction in the fat tissue that converts testosterone into estrogen. Remember the subtle role of the gut biome in mitigating the effects of environmental endocrine disruptors. A robust and diverse gut flora acts as a natural detoxification system, helping your body process and eliminate unwanted hormonal mimics. Adding varied sources of fiber, such as different types of beans, vegetables, and whole grains, feeds this beneficial gut community. Variety in your diet leads to variety in your microbiome, strengthening your body's internal defense against hormonal sabotage. A final word on the sharpness softener. Protect your hearing. Hearing loss often forces the brain to dedicate excessive cognitive resources simply to deciphering speech, stealing processing power that should be used for memory and complex thought. This continuous overexertion contributes to the brain fog associated with low vitality. Wear ear protection in loud environments like workshops or concerts. Protecting your hearing today is a crucial step in maintaining your cognitive function and clarity in the decades to come. The journey we have outlined is one of self-mastery. It is about taking the subtle, silent signals your body sends and responding with informed, powerful action. You have learned that the feeling of fading vitality is not a default setting for men over 60. It is often a fixable hormonal imbalance triggered by lifestyle or treatable medical conditions. You are now equipped with the 7 key signs, the language for your doctor, and the foundational lifestyle pillars, sleep, strength, and steady nutrition, needed to fight back. Use this knowledge as your blueprint, take control, schedule that appointment, and start those positive habits today. Never underestimate your body's capacity for repair and renewal. We believe in your ability to reclaim your vigor. If you are serious about this level of dedication to your health, subscribe to Gentleman's Vitality and let us be your guide. Continue fighting for the strong, vital life you deserve.